Have you ever questioned why your erectile firmness isn't what it once was? Most men assume it's purely about testosterone levels or cardiovascular circulation, but there's a concealed reality. The power of your pelvic floor musculature is absolutely crucial. These specific muscles function to trap blood within the penile tissue and sustain rigidity. Similar to every other muscle group in your body, without proper conditioning, they deteriorate as you age. This is precisely where Kegel training becomes essential. The common misconception is that Kegels are exclusively designed for women, yet through my clinical practice, I've witnessed men in their 5th, 6th, and even 7th decades completely revolutionize their intimate capabilities merely by conditioning these overlooked muscle groups. In this guide, I'll demonstrate the 5 most effective Kegel techniques that require no equipment and can be performed in the comfort of your home to promote stronger erections, enhanced control, and superior bladder function. Continue watching through to the conclusion, as the last technique is frequently overlooked by most men, yet it represents the true breakthrough for sustained erectile strength. Position yourself comfortably on your back with your knees flexed to approximately a 45-degree angle, ensuring your feet rest flat against the surface, spaced at hip width for maximum stability. Rest your arms comfortably alongside your body with palms pressed downward so your entire frame feels completely supported and at ease. Allow yourself a brief moment to settle completely into this posture, permitting your respiratory rhythm to become calm and consistent. From this foundation, direct your focus toward your lumbar spine area. Carefully contract your abdominal wall, visualizing drawing your navel inward toward your backbone, and flatten your lower spine firmly against the surface beneath you, as though eliminating any gap or curvature underneath. Simultaneously, rotate your pelvis gently upward, just sufficiently to sense muscular engagement without generating strain or producing discomfort. You should experience a mild yet clear contraction throughout your lower abdominal region and deep within your pelvic musculature. Maintain this contracted state for 3 to 5 seconds initially, continuing to breathe evenly through your nostrils, then gradually return to the neutral starting position with deliberate control. What you're accomplishing here might appear elementary from an external perspective, but it delivers extraordinary benefits for your intimate wellness. You're not merely activating the pelvic floor musculature, but simultaneously connecting them with your lower abdominal muscles and generating what specialists term co-contraction. These are precisely the muscles that contract in rhythmic patterns and secure blood within the penile tissue throughout an erection, functioning essentially like an organic constriction device. Through daily practice of this technique, you're conditioning those muscle groups to collaborate efficiently on demand, developing both power and synchronization. An additional vital advantage of the pelvic tilt involves body consciousness, what rehabilitation specialists refer to as proprioception. Numerous men remain unaware of how to deliberately activate their pelvic floor until they begin implementing this fundamental movement. It's comparable to realizing you possess a muscle you previously didn't know existed. Progressively, you'll start sensing precisely which muscles are activating, their anatomical location, and how to recruit them more efficiently whenever necessary. This improved awareness can translate to firmer, more dependable erections, superior control throughout intimacy to postpone climax, and even substantial enhancements in bladder strength that minimize urgency and frequency. Begin with 10 to 15 repetitions, sustaining each tilt for those essential few seconds. Prioritize precision over volume. It's far more beneficial to execute 10 flawless repetitions than 20 careless ones. As your musculature develops strength throughout the upcoming weeks, progressively advance toward 20 or potentially 25 repetitions. With dedication, and this aspect is critical, you'll observe that your physiology responds uniquely. It feels as though you are securing firmness rather than allowing it to diminish. Some men even characterize it as recovering authority over a bodily function they believed they had permanently surrendered to the aging process. Next, we explore the prone stretch. For this technique, lie face downward on the surface, positioned on a cushioned mat or carpeted area, with your legs completely extended and your elbows situated directly beneath your shoulders. resembling the initial phase of a gentle cobra posture, or as if preparing to read while lying prone. Your forearms should rest flat against the surface, parallel to one another. Elevate your chest moderately off the ground, maintaining your neck in neutral alignment and your visual focus forward or slightly downward to prevent neck tension. From this position, activate your abdominal muscles by carefully drawing your navel inward toward your spine. Visualize attempting to generate space between your abdomen and the floor, and simultaneously contract your pelvic floor gently. Imagine carefully elevating those deep muscles as if halting urination midstream. This technique may not appear particularly challenging to an outside observer, but what it accomplishes internally is distinctive and substantial. It elongates and extends the muscles along the anterior aspect of your abdomen, including the hip flexor muscles that frequently become restricted from prolonged sitting, while simultaneously forcing the deeper stabilizing muscles, the pelvic floor, the transverse abdominis, and the lower abdominal wall, to contract in flawless synchronization. That equilibrium of stretching and contraction is what renders this exercise remarkably beneficial. It doesn't merely construct raw power, it develops flexibility, stamina, and muscular coordination, which are all fundamental for optimal intimate performance and sustaining erections. Numerous men who incorporate the prone stretch as a consistent component of their daily regimen report a significant decrease in chronic lumbar tension, considerably enhanced posture throughout their day, and most critically, a more powerful, more deliberate connection to their pelvic floor during intimacy. That amplified connection means when the critical moment arrives, the neurological signals between your brain, your musculature, and your erection are clearer, more rapid, and more powerful. It's comparable to upgrading from outdated dial-up to high-speed broadband for your nervous system. Sustain this stretch for 20 to 30 seconds at a time initially, concentrating on steady diaphragmatic breathing and gentle yet purposeful muscle activation. Never hold your breath. Oxygen circulation is vital for muscular function. Repeat it 3 to 4 times with 10 to 15 second rest intervals between holds. As you advance through weeks of consistent implementation, progressively extend the hold duration to 45 seconds, or even a complete minute. You'll discover that your pelvic region feels simultaneously looser and more powerful, the precise combination you require for lasting firmness, enhanced blood circulation, and superior control. The third technique is the kneeling abdominal draw-in. Commence by positioning yourself on all fours in what yoga instructors identify as the tabletop position, situating your hands directly beneath your shoulders with fingers expanded broadly for stability and your knees positioned directly beneath your hips. Your spine should be entirely neutral, not arched like a frightened cat or sagged like a hammock, but naturally aligned. This position alone assists in aligning your complete body and eliminates unnecessary strain from the lumbar spine while preparing your core for activation. Now execute a slow, intentional exhalation through your mouth. As you do, carefully draw your navel inward toward your spine, flattening your stomach without restricting your breath or generating tension in your shoulders. At the same time, contract your pelvic floor muscles. Visualize for a moment that you are attempting to halt the flow of urine midstream, or picture gently lifting your testicles or subtly drawing the muscles inside your pelvis upward. Sustain this coordinated contraction for 3 to 5 seconds while maintaining your shoulders relaxed, your neck neutral, and your breathing smooth and regulated, then gradually release with control. This movement might appear minimal from the exterior, but what's occurring inside your physiology is profound. You're activating the deep core musculature, particularly the transverse abdominis, the muscles that wrap around your midsection like an organic corset or lifting belt, while simultaneously conditioning the pelvic floor to function in harmony together. These muscles generate spinal stability, enhance pelvic circulation, and strengthen the neural connection between your brain and your intimate function. What renders this exercise particularly distinctive and valuable is the manner it connects conscious breathing and precise muscular control. By learning to contract during exhalation and relax during inhalation, you're training both endurance and coordination, two elements that directly translate to greater staying power and deliberate control in intimate situations. Men who implement this technique consistently often describe discovering a new dimension of awareness of their pelvic muscles they never realized was attainable. Rather than feeling disconnected or lacking control, they can sense and deliberately control those contractions more effectively, which assists them in staying firm longer and postponing climax when they desire, a capability that enhances both their pleasure and their partner's satisfaction. Begin with 10 to 15 repetitions, always moving gradually and steadily with complete concentration. Quality matters significantly more than quantity here. Over time, extend the hold to 5, 7, or even 10 seconds as your endurance improves. You can also attempt variations, such as slightly shifting your weight forward or backward to recruit different muscle fibers. The fourth exercise is the bridge abduction. Lie flat on your back on a comfortable surface with your knees bent at roughly 90 degrees and your feet hip-width apart, firmly planted on the ground approximately a foot from your buttocks. Position your arms alongside your body with your palms facing downward for support and stability. Take a moment to locate your neutral spine position. Now, press your heels firmly into the floor. Engage your glutes and elevate your hips upward toward the ceiling, forming a perfectly straight line from your shoulders through your hips to your knees. This is your bridge position. Maintain it steadily. While sustaining the bridge with proper form, carefully push your knees outward, as though you're attempting to separate the floor apart with your legs or extending a resistance band. Then bring them back to the starting point with control. The movement should be fluid and intentional, not jerky or hasty. What renders this technique so incredibly powerful is that it works multiple vital muscle groups simultaneously in a coordinated fashion. You're strengthening the pelvic floor muscles, which assist in trapping and maintaining blood inside the penis during erection, while also powerfully activating the glutes, the largest and most metabolically active muscles in your physique. Additionally, you're targeting the frequently neglected hip abductors and stabilizers, which are essential for pelvic equilibrium, stability, and optimal circulation. When these muscles are weak or inactive, blood flow to the pelvic region is often substantially compromised, but when they're strong and responsive, they function like auxiliary pumps, helping drive fresh, oxygenated blood where you need it most for strong erections. The bridge abduction also effectively retrains your body to maintain firmness under pressure and movement. By keeping the hips elevated while dynamically moving the knees in and out, you're simulating the type of muscular control and endurance required during intimate encounters. This functional strength translates directly to enhanced performance. Start with 8 to 10 repetitions, sustaining each outward push for 2 to 3 seconds before returning to center. Focus on keeping your core engaged throughout to prevent your back from arching. As you grow stronger over weeks of practice, increase the number of reps to 15 to 20, or add a resistance band around your thighs just above the knees for extra challenge and muscle activation. Men who maintain this exercise consistently often report not just noticeably firmer erections, but also improved pelvic stability and hip mobility, meaning less fatigue, reduced lower back strain, and greater control during longer intimate encounters. It is truly one of the most effective techniques for building a strong, stable foundation that supports both intimate performance and overall confidence in your body. Finally, the most overlooked yet incredibly powerful technique, the rocking frog stretch. Begin by getting down on your hands and knees, positioning yourself on all fours on a padded surface or yoga mat for comfort. From there, slowly and carefully widen your knees apart. Go as wide as feels comfortable without strain, keeping your feet turned outward so that your inner thighs are fully open and your hips can sink lower toward the floor. Your knees should form a wide V shape. Now gently lower down onto your forearms, keeping your spine neutral and your head relaxed. This position may already feel like an intense stretch through your inner thighs, groin, and hips, and that's exactly what you want. Take a moment to breathe and adjust to the stretch. Once you are comfortable and stable, start rocking your hips forward and back in a slow, controlled, rhythmic motion, almost like a gentle wave moving through your pelvis. What this technique accomplishes is truly distinctive in the realm of men's pelvic exercises. It deeply stretches the adductors, or inner thigh muscles, while also opening up and releasing the deep pelvic floor muscles that often become chronically tight with age, prolonged sitting, stress, or lack of flexibility training. When those tissues are tight and restricted, they create a tourniquet effect that restricts blood flow and creates excessive tension in the pelvic area, which makes it significantly harder to achieve and maintain strong erections. By gently opening and relaxing these muscles while simultaneously engaging your pelvic floor in a dynamic way, you allow blood to flow more freely into the erectile tissue and, crucially, remain there when you need it. The rocking motion is particularly important and shouldn't be skipped. It doesn't just provide a static stretch. It creates fluid movement through the entire pelvis, which dramatically improves circulation, promotes lymphatic drainage, and trains the muscles to activate and relax in perfect harmony. That balance of strength and relaxation is absolutely critical for intimate function. Too much chronic tension in the pelvic floor can restrict blood flow and cause premature ejaculation, while too little strength fails to lock blood in for firm erections. This exercise helps you find and maintain that sweet spot of balanced muscle tone. Spend 30 to 40 seconds in this position initially, moving gently with the rhythm of your breath and breathing deeply into your belly. Focus on relaxing into the stretch rather than forcing it. Repeat the stretch 3 times with 20 to 30-second breaks between sets. If you find the position challenging at first, don't force it or push through pain. You can modify by not going as wide with your knees or by placing a pillow under your chest for support. With consistent practice, your flexibility will improve dramatically and the stretch will feel more natural and even pleasurable. Over the course of just a few weeks, many men notice a clear, significant difference in firmness, sensitivity, staying power, and even the intensity of their orgasms. Some report that this single exercise feels like it unlocks or awakens the pelvic region, allowing them to experience a stronger, more responsive erection than they've had in years or even decades. Think of the rocking frog stretch as both a strengthener and a releaser, a yin and yang exercise. It builds control while releasing chronic tension, restores healthy circulation while teaching your body how to move fluidly and naturally, and ultimately supports both peak performance and lasting comfort. When paired with the other 4 exercises in this routine, it becomes the finishing touch, the one move that can take your results from good to genuinely great. So there you have it, the 5 best Kegel techniques to restore harder, more reliable erections after 50. These are not quick tricks, temporary fixes, or gimmicks that overpromise and underdeliver. They are practical, scientifically proven exercises that systematically retrain your body to hold blood flow, increase penile sensitivity, and give you more conscious control over your intimate response. The key to success is consistency and patience. Just 5 to 10 minutes a day, less time than you spend brushing your teeth, can lead to noticeable improvements within a few weeks, with more dramatic results after 2 to 3 months of regular practice. And remember, these exercises don't just help with erections. They also significantly improve bladder control, reduce nighttime urination, alleviate pelvic tension and pain, and support overall confidence in your body and your masculinity. For best results, perform these exercises daily, ideally at the same time each day to build a habit. Many men find success doing them first thing in the morning or right before bed. Track your progress in a journal, noting improvements in firmness, control, and overall intimate satisfaction. Stay committed. Try these moves daily without fail, and you may be genuinely surprised at how much stronger, firmer, and more youthful you feel. Remember, it's never too late to strengthen these crucial muscles and reclaim your intimate health. If you found this helpful, share it with a friend who could benefit from this knowledge, and don't forget to subscribe for more evidence-based men's health guidance.